This is Dakota Rogers, family nurse practitioner student for Albany State University, and today I will be performing my pediatric toddler assessment on Miss 4-year-old Aubrey. Aubrey is a 4-year-old toddler, and today she's in for a well check. Her mom states that Aubrey hasn't had any problems since her last visit into the clinic for her last well check. She lives with her mom and 2 brothers. Mom states that Aubrey is eating well and drinking well, and states that she is performing well with her level of activity for age appropriateness. Aubrey's running and jumping without difficulty. She feeds herself well with a spoon and with a fork as well, and she's also able to dress herself appropriately for morning and bedtime. And Aubrey's also able to count to 20. She knows her colors and she can actually draw shapes. She's now attending pre-K at the 4-year-old pre-K program. And for our assessment, we'll start with just general appearance. Aubrey is very clean and she's very neatly groomed. Her behavior is appropriate. Development is appropriate for Aubrey's age. She's alert. She responds appropriately to age-appropriate questions for her. Aubrey, do you know how to brush your own teeth?
Yeah.
You do? Do you know how to put on your own shirt and pants?
Yeah.
What about shoes and socks? Can you put on your own shoes?
Yeah.
Very good. Do you know your colors?
Yeah.
Tell me some colors.
Red and blue and red and blue and green and red.
Very good. That's good. That's very good. All right, we'll start by getting some measurements on Aubrey. We checked her weight on the standing scale, and her weight was actually 40 pounds. We can check Aubrey's length. We can stand her up on a height scale on the wall. For the sake of this video, we're going to check her length with a tape measure. I'm going to have Aubrey to lay back flat for me on the bed, and we will start at the very tip of Aubrey's head, and we're going to measure down to the heel of her feet. And Aubrey's length is 42 inches long. You can sit up. Very good. And also with the tape measure for a demonstration of chest circumference. Hold your arms out for me like a helicopter.
Helicopter.
Very good. Do you know what a helicopter is?
Fly.
It flies. That's very good. Chest circumference is 21 inches on Miss Aubrey. Vital signs were assessed. Heart rate was 106. Her respiratory rate is 22. Temperature was 98.7. It was taken orally. We can start by taking a look at Aubrey's skin. Her skin is very smooth. The skin color is normal for her race. We can look inside of her hands. We can look at her mucous membranes. They are all very pink and moist. And she doesn't have any rashes or any lesions or any discolorations to her skin in general. There's nothing noted. And her skin is warm and dry. We can look at Aubrey's nails on her hands. Her nails are very neatly groomed. There are no ridges in her nails. They're very smooth. And capillary refill is less than 2 seconds. Very good. Put those in your lap for me. You can also look, if you flip your hands out for me, can I see the palms of your hands? We'll assess the palmar creases in the hands, and those are symmetric, and in the center of the hand, there's no deformities noted to Aubrey's hands or her feet. And then we can start with the body assessment by looking at her head. Her hair is very thick. It has a curly texture to it. It covers her scalp completely, and it's evenly distributed throughout. And in assessing the scalp, I don't feel any type of bumps or lumps. There's no bruising noted. No deformities are felt to the skull. It's very smooth and round. We can move down further, okay, and assess the limp. Hold your head up for me.
Tickle.
Tickles. Assess the limp. And there's no swelling, enlargement, or movement of the lymph nodes. Aubrey's very ticklish. Very good. And then looking at the neck, we see that it is midline. Sit up straight for me. Be a big girl. Neck is midline with her shoulders. We can assess Aubrey's trachea. Can you swallow for me? Swallow. Very good. Assess the trachea is midline there, and there's no deformities. Everything is symmetric, and the thyroid can't be palpated. But it's a very smooth motion when she swallows. And then we can move on. We can look at Aubrey's eyes. We see that her eyes are symmetric here. We can look at her conjunctiva. Open your eyes for me. Very good. The sclera is white. The conjunctiva is moist. We don't see any drainage or redness or swelling there. No redness or swelling in the sclera as well. We can shine our light and take a look at Aubrey's pupils. Look straight ahead. Look straight ahead, sweetie. Look at my nose. Very good. Aubrey's pupils are equal and round, and they are reactive to light. I want you to look at this. Look at this little item right here for me, okay? And I want you to follow my finger with your eyes, but don't turn your head. Can you do that? Very good. Very good. Very good. And we'll move on further with the assessment. She is able to fix and follow objects without difficulty. Outer eyes are symmetric with her face, and there's no deformities with the shape of her eyes or her eyelids. And then we'll move on to Aubrey's ears. Her pinna, they're equally aligned and symmetric to her head. Don't see any drainage. Nothing is visible in the outer ear canals there. She easily turns towards sounds. If I stand on one side, what do you hear? What am I doing?
I'm snapping.
Snapping. Very good. And we can take a look inside the eyes. The ears, sorry. Okay. And when we assess here, we're going to pull down it back. Very good. And then we're going to take a look at your other ear right here, okay? I'm sorry. Tympanic membrane is pearly and gray. You can see the cone of light. There's no redness, no edema, no discharge in the inner ear as well. The inner ears are clear. And then we can move on to look at Aubrey's nose. Tilt your head back for me. I'm going to take a look inside your nose, okay? Open it up. Very good. Looking inside the nose, the mucosal lining of Aubrey's nose is pink and moist with no drainage there. Her nares are patent bilaterally, and her septum is midline. Then we take a look at Aubrey's mouth and throat. Can you open up real wide for me? Say, ah. Stick your tongue out. Ah. Very good. Looking inside, the membranes are pink and moist. Her tongue is midline and moist as well. There's no deformities, no cracks. The tongue is very smooth. The palates are smooth with no discolorations as well. I don't see, open them up for me. Can I see your teeth? So now open real wide. Ah. Don't see any dental caries there. The teeth are in good shape. Dentition is very good. And the tongue is, like I said, very smooth and moist. And then we'll move on to Aubrey's chest. Looking at her thorax. Her thorax is appropriately shaped and proportioned. It's even with the rest of her body, with the lower portion of her body. She has an even rise and fall of her chest when she breathes. We can listen to some heart sounds. Going to use the bell of our stethoscope here. We'll listen to the aortic. And then we'll listen to the pulmonic. Tricuspid. And then we'll listen to the mitral. Don't hear any murmurs there. The heart rate is very even with the rate and with the rhythm. It has a good rate and rhythm as well. And then we can also go ahead and listen to your lungs. Alright, this is what I want you to do for me. I want you to open your mouth for me and take a big breath in like this, and then out. Hold still for me. Very slowly, slow. Do like me. Very good. Now do that again. Very good. Do it again. Do it again. We're going to listen on the back side. Do it again for me. Again. 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 Very good. Lung sounds are clear. And the respiratory rate is even in non-labor. We can move on to check the vascular system and check the pulses. We can feel for carotid pulses, and we check these one side at a time. Look straight at me. Look straight ahead. You can also check the brachial pulses here. Flex the elbow. Try no still for me, okay? And then we can feel for radial pulses. The femoral pulses would be here in the thigh. We can also check popliteal pulses. They would be here behind the knees. And the dorsalis pedis here. And then we would look at the capillary refill that we checked earlier is less than 2 seconds. And then we'll look at Aubie's tummy. Can you lay back for me? Very good. Okay, I'm going to slide you down to the camera. Very good. Gonna listen to your tummy. Just lay still for me. And we would listen in each quadrant. Lay still for me for a full minute. Vowel sounds are hyperactive. Well heard. You can hear the gurgles and the clicks there. And we can also palpate there. Very good. Not palpate any organs there. Can feel some stool in the colon there. Come on, sit up. Very good. Very good. And then we would look at all of Aubrey's joints. Make sure that her joints are intact and working appropriately with flexion and with abduction. We would check to see that her hips are symmetric.
I know, like ABCs too.
As well, we would check the knees to be sure that they bend, extend, and flex very well for us. Very good. And that concludes our assessment.